Okay, hi. Thank you all for joining me for the next hour. My name is Carolyn Eddy. I am a licensed clinical therapist, a licensed clinical social worker. Sorry, a little nervous. A brief little about myself might be important. Kind of new to Tahoe, 3 years now. New to Barton as of March. Prior to that, I was working at a local nonprofit and was a part of getting wellness centers going on some of the school campuses. So that was a really lovely experience. And prior to that, I practiced as a therapist in Alaska for 7 years and in Eureka and Arcata, California for another 7 prior to that. I love what I do. I'm passionate about mental health. I'm especially passionate about being able to access and build our capacity to talk about difficult stuff. And a big difficult thing is emotions and feelings, and which are at the core of what we're talking about tonight, and it's suicide prevention and awareness. So that's me. I love it here in Tahoe. I feel that I've gotten a good feel for the youth voice and kind of what they say and what they need from us adults to kind of show up better for them in their life and help them work through stressors in life, because we all know that there's a lot out there. Okay, and I'm gonna bear with me as I get the knack of the turning and the reading and that. Okay, here we go. So kind of take us to an overview of what you can expect in the next hour, kind of the history of Suicide Prevention Month, defining the problem, and it's a big problem. It's something that's been taken notice for over a couple decades, and it's still a really big problem. And it takes us as a community to help heal the community, heal our kids, heal our parents, and our adults. We'll look just kind of briefly at some statistics. You know, we could gather statistics from all over to kind of build a case. It's not hard to build a case on what the problem is and what we should do about it. Talk about some terms, suicide ideation. It might be a familiar term for folks on. I kind of anticipate kind of the crowd out there is adults mostly, maybe some young adults, parents, caregivers, Barton employees, all of it. So trying to keep it kind of general, but also it's really focused on youth and kids and how adults, parents, caregivers could respond better. And a big piece of that is managing our own emotions when people bring us difficult things. And that's the hard part. And the 18 years I've been a therapist, I see it time and time again. And that's the sticky point for kids and young people, is when their parents kind of have some apprehension about that emotion or feeling that their kids bring to them. We'll talk a little bit about tips to advocating for your loved ones for their mental health needs, and it's definitely that. I mean, our system is far from perfect. It's made lots of gains, and also it takes an advocate sometimes to be loud and kind of get what you need for your kid, your person you care for. And then a little bit of homework, which I don't grade, you'll never know, but something I hope that you could take back to your families, to your work, to make our community a little happier. Okay, to start, so September 10th, that was just 2 days ago, was the first World Suicide Day globally, and that started in 2003. And that was all about increasing awareness of the importance of reducing the stigma and encouraging conversations to prevent suicide. And this was the first global effort to say, hey, this is happening across the world. It's a problem. It's preventable. We need to do something about it. This year in September in the United States, it's Suicide Prevention Month. So you kind of have themes throughout the years, and this theme this year is changing the narrative on suicide. And I really like that, because that's really what it's about. It's about us. It's a call to action to start these conversations, and no matter how small or big, they could be really meaningful and impactful. And the World Suicide Day was a partnership between the International Association for Suicide Prevention and the World Health Organization. All right, next one. Okay, so just some statistics. 2022 saw the highest death by suicide in the United States. And again, this is after 2.5 decades, 2+ decades of like, hey, globally, this is a problem. In the United States, it's certainly a problem. And so 2 decades later, we're still seeing that it's increasing. Suicide was the 11th leading cause of death overall in the United States, claiming over 48,000 lives. The second leading cause of death among young people aged 10 to 14 and 25 to 34. Males are 4 times higher suicide rate than females, highest among Alaskan Natives. In 2022, 13.2 million adults had serious thoughts of suicide, and 1.6 adults attempted suicide. So these aren't completed acts, but this is lots and lots of people throughout our country who have thoughts and aren't well. Uh-oh. My screen, oh, here we go. Panic for a second, here we go. Okay, 1 in 6 US youth aged 6 to 17 experience a mental health disorder. And this is being pulled from the CDC and SAMHSA, Substance Abuse and Mental Health Services Administration. And those are kids who are diagnosed. They go to a provider, they get diagnosed with a mental health disorder. That number is higher with adults who might just experience some heavier mental health issues on some days and don't necessarily have a diagnosis yet, but that their mental health is maybe a problem. 50% of all lifetime mental illness begins by the age of 14. Again, kind of another reason why it's so important early intervention, help support our kids from birth on ways to communicate how they're feeling. At least 8.4 million people provide care to an adult with a mental health issue. That's a huge impact on our society. Transgender youth are 4 times more likely to attempt suicide, and the treatment gap. So this was a little dated, but still, that's 5-6 years ago. In 2018, about 50% adults who received treatment for mental health conditions. And that number is not that much more now. So people who are struggling still aren't accessing mental health, or there's struggles getting in. Like I said, we all know that's not a perfect system. So even more of kind of a call for action locally in our community to have those conversations within our homes, within our workplace, with our friends and family. And there was, in kind of reviewing some literature, noted that it wasn't unusual that people who had completed suicide had been seen by some sort of provider within the 2 months prior to their death. And so just looking at missed opportunities for screening, how we talk to people, how we approach the situation is really important. And I think that's, for me, in my practice over the years, and these agencies who are providing so much stuff to our schools and kids about education, that what I think we're really missing is at a parent level, teacher, coaches, providers, friends, adult level, that we need to be better at finding ways to talk to our young people about emotions, experiences, and their worries in life. So some terms: suicide ideation. This is this kind of planning, thinking, wondering. Might describe in my work with teens, and that was my focus, has always been my focus over the 18 years, is with kids and families, largely in the foster care system, but always with kids and their families. So a lot of family work. I believe in that work. It's hard work, but that's where shift really happens in a positive way. So it's not unusual that kids I see, adults I see, suicide ideation, like the thought of ending their life flutters through their brain sometimes. And that's and sometimes I like to say it kind of takes up space a little bit, and sometimes it grows and it becomes a little bit more. Do they have a means? Do they have a plan? And this is a perfect area to ask those questions and to intervene and to be that voice a little bit. And I don't want to jump ahead because that's what I'm kind of doing, but it's not uncommon. Actually, it's pretty common for youth and adults who experience any sort of depression, anxiety, mental health issues, that some suicide ideation kind of occurs at times. And it's important to be able to have someone to talk through that. Stigma is a term largely connected with mental health and particularly with suicide. Stigma, it's a mark of disgrace associated with a particular circumstance, quality, or person. You know, this often prevents people from seeking help. It prevents people from sharing their story in fear that they're going to be judged. And this is, again, this call to action, have conversations is so important. Okay. So when we're talking about suicide prevention and awareness, we're really talking about what are the risk and warning signs versus what are some protective factors. And we're going to lead into the protective factors here soon, excuse me, but going through kind of some risk factors and warning signs. I have a couple of different slides on this, so we'll go here. Suicide warning signs for youth, talking or making plans, expressing hopelessness about their future. For teens, it's not unusual, this irritability, this anger, it's not unusual to have some mood swings in that. When does it become kind of a, oh, this is pushing the normal teen development? It's not uncommon for me to hear young people say that their parents just call them lazy all the time. That why you're lazy, you're defiant, you're not listening, you're not doing the things. And when our eyes are looking through a lens of one that's not maybe attuned to mental health, that we're more easy to not see a behavior that's right in front of us, which laziness is often can be also a form of depression, isolation, not wanting to do anything. Other things, displaying severe, overwhelming emotional pain and distress. Worrisome changes. Always, if you see a marked change in your kids or even an adult, a friend's behavior, they usually socialize, want to go out all the time, but then all of a sudden they don't, they're more in their room. Any sort of shift, you know, it's important to wonder what's going on. I notice you don't want to hang out with your friends. Withdrawal or changing social connections, situations, sleep patterns. Teens, particularly, their sleep patterns are kind of all over the place sometimes, although that's a huge piece when I'm working with families. Like, sleep is so critical, a basis, foundation for managing our emotions, our experience. We need good sleep. We need to be nourished. Other signs, recent increased agitation or irritability. And again, that's a kind of a slippery, kind of a hard thread to tease out sometimes, but ask about it. Much similar for adults, but maybe they're talking about it being a burden to others, feeling no hope, feeling stuck, this sense of like stuck, can't get out, can't do anything, job dissatisfaction. Let me just move over here. What do we got here? Some people might explicitly say, I've been thinking about wanting to die. And often the response from that person receiving that information is fear, shock, frozen. I don't know what to do. I don't know what to say. And again, we'll lead into that. I don't want to jump too far as I'm like talking fast. And other things, withdrawing or feeling isolated. That's a big one. Sleeping too much, sleeping too little. These probably kind of sound familiar, I feel, and maybe that's a little overzealous to say, but seems like there's lots of literature out there. There's lots of, the word is out that suicide's a problem. The word is out that behavior, signs, symptoms might be there, what to look for, But again, what I'm kind of reflecting, hopefully, to you all on the webinar is that how we as adults receive that person is so important. And us as adults in our families doing the work to examine our beliefs about suicide and our own kind of hiccups around particular things. And this is, you don't know if you guys have seen the iceberg before, you know, just the tip of the iceberg, what's kind of shown, oh, I'm good, I'm fine. What we see, what I see is our kids are suffering in silence. Adults too, you know, we keep things, we're proud, we don't want to be judged. What would this mean? I'm a professional, I work here, I don't want people to know that I also struggle with mental health. But it's, the more we find ways to talk about it, the better we're all going to feel. So that's what I kind of refer to suffering in silence. The kids are, adults are, and we're missing what's hidden in plain sight. So what's happening right in front of us with our kids, with our families, with our coworkers. But it's on us and to do a little bit better about being able to see a behavior and wonder about mental health, wonder about safety for self, rather than, oh, that person might be just cranky, irritable, hates their job, the kid's just lazy, defiant, doesn't want to do work. For us to be able to put on a more compassionate, empathetic lens as we look at these people in our life that we love and care about, with a little more compassion. That's what I'm hoping for. And it's tough. It's tough. Tough. But what I do know that youth want to talk. I mean, they want to share their experience. And as I'm looking at this, I'm like, don't. And this is, kind of going back to that. Okay, I'm jumping ahead of myself. Slow down. Due to our own personal stigma, whether we hold, oh, you know, I'm not like that, my kid's not like that, I know my kid, no, this and that, due to our the own stigmas we kind of hold and our own judgments we kind of hold, sometimes we don't see what's right in front of us. And that's kind of the point, and the hope is for us to be more attuned to what's really going on. But also being comfortable with our own emotions prior to doing that. So the reason I kind of said that is when I kind of teach parenting, I've taught parenting classes for a long time. And this sense of parenting, like, don't say these trigger words, don't, stop, quit. Those are like trigger words for kids. They hear don't, they do, right? Don't, do. But I'm telling you, we're adults. Youth want to talk, but they don't want your emotions to rule the conversation or the response. And this happens over and over again. And I know how it happens. I'm a mom of an 11 and 13-year-old raising. And it's hard. It's hard because our own emotional reactivity, fear, nervousness, uncertainty, what is everyone going to think? All that sort of stuff kind of comes into play when that person's in front of us talking. But that quickly shuts down our kids. They learn really early on. We're going to watch a video of it, but kids learn really early on in life, toddlerish, that their own emotions make their parent feel uncomfortable if that's the case. So a kid has a need, they feel sad, they feel frustrated, they go into their parent or caregiver for comfort. But when that feeling or emotion is uncomfortable for that parent reacts in a particular way that messages the kid, oh, that makes us both uncomfortable. You don't know how to manage my sadness. And now I don't know how to talk about my sadness because it's uncomfortable for us both. So being really able to check our own emotions, how am I feeling before you're engaging. Don't minimize and compare. This happens a lot. God, why can't you just be like your sibling? He's so easy. Or compared to others. None of the other kids are doing this. That sticks to kids, and they feel that, and they feel something's wrong with them. Something must be really wrong. The word crazy, super big, not a feel-good word for somebody who's struggling with mental health. And that's in part too because of the stigma, right? Mental health, you must be this. We all have this particular image in our mind about particular things, disorders, substance use, and that really informs how we receive other people. Don't argue, blame, or make excuses. Oh, you're just a teenager, it's normal. It's not that big a deal. You don't even know what it's like. When I was your kid, when I was your age, we all have been guilty of that. If we're parents or have heard that or have received that from our own parents or caregivers, it never feels good. It's really minimizing. Okay. So if we're moving on a little bit to protective factors, this is like, for me, this is the fun and joy, because it's talking about mental health, it's talking about doing things differently, it's talking about communities. And I'm going to kind of zone in on a couple of these: parent connectedness, connections to other non-parental adults. And these are mentors, coaches, teachers, counselors, other people outside the family that's a healthy adult that young person could go to when maybe they don't feel open to go to their parent. Awareness of and access to local health services, neighborhood safety, closeness to caring friends. Okay. Cultural and religious beliefs are also a really strong protective factor. Interpersonal and community connectedness. And since being here in Lake Tahoe, I've really appreciated the community, the people and positions, the school district. And I could say, in part because I was involved in the school district and getting the wellness centers up and going, and there's a lot happening in the district to support social emotional wellness, which is really beautiful. Counselors are lovely and are often like a good initial contact if you're struggling. But again, we'll get to that. Okay, here we're approaching this video, and I'm going to try to remember what Natasha said, but just to kind of set you up for this video, it's a YouTube clip on this parenting curriculum called Circle of Security. I did this in Alaska for 7 years. I loved it. Thinking about starting some sort of parent group in the community at some point. But this little clip is about the importance of the parent adult to be able to manage their own emotional reactivity response when their young person might want to come in and talk about their feelings or talk about something difficult like suicide, or, hey, I'm having thoughts about wanting to end my life. It's a really tough thing for a parent to hear, or a friend to hear. It's a really hard thing. So I know this is all hard work, but we're capable of it. And so this little clip kind of summarizes a little bit on the importance of emotional regulation for adults and what happens from the kid's perspective when the adult reacts versus responds. Okay, let's see. Oh.
I'm here if you need assistance.
Okay. I think I got it. And we're going to share. Let's try it. So it's called Being with Shark Music.
Parents. Throughout history, we've struggled to get it right. We hope we won't pass on our emotional issues to our kids, and we swear we won't make the same mistakes our parents did. We all have great intentions, but something seems to get in the way. Let's look at what that might be. At Circle of Security Parenting, we believe that being emotionally available to our children in their needs is the key to doing our best as parents. We call emotional availability being with. It means teaching emotional intelligence by being with our children in all their feelings, like sadness, joy, anger, curiosity, pain, frustration, excitement, and so on. Being with children helps them understand, trust, and move on from feelings. And knowing someone is with them in their feelings helps children feel less overwhelmed and more secure. Decades of research backs this up. For parents, some of this comes easily. But other times, our children express emotions that make us uncomfortable. So we pull away or try to overrule their feelings, which leaves them on their own. We do this because our children's feelings can trigger strong emotions in us. We think of it like this: our history during childhood of how core people responded to our different emotions creates the background music for how we experience our children's feelings. Let's look at this example. This girl and her father have been enjoying time together in the park, but suddenly aware of the time, Dad says, "We need to go." When the girl hears this, she starts crying and gets increasingly angry. All at once, the dad's background music changes. The background music that is playing for the father right now, we call shark music. As it turns out, the dad's own mother was uncomfortable with loud displays of emotion, and she didn't know how to handle them. So throughout his childhood, she repeatedly told her son it was pathetic to cry, and she never ever asked him about his feelings of sadness or anger. His ability to deal with his daughter's emotion now is greatly affected by the experience with his mother then. Shark music. We're rarely aware it's playing, but it's our past experiences telling us to be afraid of or uncomfortable with a feeling or need that is actually safe. When our shark music limits our ability to respond to these feelings, our children learn to hide or feel ashamed of them. This is a problem because we're teaching our children to fear emotions that are actually both safe and essential in life. Most of us experience shark music with one emotion or another, and it's different for everyone. But whenever it is triggered, our ability to respond to our children's needs is limited. The good news is, by simply calling it by name and reflecting on what our children need in the moment, we can turn down our shark music. This is so important because if we can learn to manage our history of negative experiences and perceptions, we can respond to the truth of our child's current situation and be with them in it. Ultimately, this will help our children grow up with a better ability to understand and share more of the emotions they experience. There's no escaping it. Strong feelings are a challenge to manage as parents, but our children always benefit when we have an accurate response to what's happening, rather than reacting to the shark music we're bringing into the relationship. Remember, there's no such thing as perfect parenting, and blame never helped anyone feel more secure. That includes blaming ourselves. But the more often we can identify our shark music, the better off our children will be.
Carolyn, you're muted. You hit the mic at the bottom left. There you go.
And I could do it.
You might have to, share, and then go back in again.
Okay, doing it. Thanks for being patient. Okay, now I got to get back to. I love that video. I love that video because I think it really summarizes really nicely what interferes with a more gentle, kind, thoughtful response to our kids, particularly when they need things from us. And this is really at the core of suicide prevention and awareness, being willing to receive that person who comes to us with big feelings. And it's hard, it's a struggle, and it takes effort, but it's necessary, because a lot of the times adults are missing the mark, and we need to show up a little bit better for our kids. And it's all about emotional regulation. How does one have a stressor, whether it's as small as like forgetting some homework, or a bad test, or you messed up at a meeting at a job, some sort of charge, and how do we work through that in a meaningful way so our emotions aren't getting the best of us, so we could be clear and level-headed. And so that's really at the core of suicide awareness and prevention, is really identifying those feelings, having spaces to be able to talk about dark feelings. And that's not always going to be necessarily with a parent. I realize that, because it's hard for parents to receive. But being able to find that person, find that adult therapist, psychiatrist, neighbor, mentor, to be able to have those conversations when needed. Building that community around our kids is important. And with parenting, and part of that parenting curriculum, it really speaks about, in parenting, there's lots of ruptures, meaning when things don't go right, or when we as parents or caregivers are like, oh, I really lost my cool. But the repairing part is so important. Hey, I'm so sorry. You came to me and you were feeling really sad and I wasn't there. Can we try that again? You know, that speaks a lot to our kids. That tells them that we're human too, and that we don't have it always perfect. And so now I'm just gonna go through some things to do. Please ask questions if you have. What we want to do is we want to be able to normalize emotions. We want to be able to say, like, hey, you know, it's normal to have big emotions sometimes, and let me help you find a way to manage those feelings. Connection, time together without distractions is really important. And Dr. Tracy Patel did a webinar, I think it was last month, on a healthy relationship with the phone. And I can't remember the book name, but some of the graphics on her presentation, you might want to go back and look, but talking about how over the last 10 years, our face-to-face interactions, the time spent together, sharing meals, doing activities, going for walks, neighborhood stuff, has really decreased. And what's increased is phone use, social media, things that are taking us away from what's right in front of us, the people that we love and care about. And that comes up, I mean, when I was during my previous employment at the wellness centers, I mean, I probably spoke to over 700 kids through the middle school, BSU, and the high school. And I would easily say that they all remarked about wanting more time with their family, feeling that their parent or caregiver was always on their phone, or they're always tired. And that's really legitimate stuff, being tired, we're all working really hard. But how to find those moments and really make the best of even 15-minute conversation goes a long, long way. And that's part of the courage to have these difficult conversations, to ask the questions, hey, you've been saying this, you've been saying you haven't felt really hopeful. Have you ever thought about wanting to kill yourself? Have you had thoughts about wanting to hurt yourself? That often is such a relief to hear from another person when you've been holding on to those feelings, when you've been holding on to their own, feeling like you're alone in that. And so when someone asks you that, often it's a relief. And then to follow that as far as our response and how do we kind of hold that person and kind of be available. Share your story. This is this is what they have identified as the number one way to reduce stigma, is talk about it, you know, and that's not just, you know, that's not just spilling your business at work meetings. That's strategically kind of, hey, someone comes to you with something, hey, I notice you're kind of, you know, you haven't been yourself this day. You want to talk about it. You know, I struggled with, you know, feeling sad sometimes. Share stories, talk about it. For myself, I'm no stranger to mental health, personal, family, work. Like I've seen it from all angles, and there's power in sharing our story, and it gives people around us permission to share those, to know that they're not alone. Asking questions, asking our questions and listening. That's seems like an obvious one, but again, we're kind of missing the mark. We're not really actively listening. We're not really actively engaged as much as we could be. Empathy, being able to put yourself in another person's shoes. It's a good skill, and that's going to be the last video. Managing your own feelings, kind of like what we talked about. And that's really what I hope to stress today is really being mindful of our own experience when we might interact, whether it's a patient through our work, whether it's a student in your class, to be able to manage our own feelings and know that it's impactful for that other person. Examine your own beliefs about mental health and suicide. What's your culture kind of say about it? What's your family beliefs about it? What are your personal beliefs about it? That I can't tell you how many times I've heard, well, my parent doesn't believe in mental health, or they don't get it. We don't talk about that. Like, it's just, you just kind of buck up and go. There's no room for feelings because we just got to work or whatever. But I hear it all the time. Like, oh, I don't believe in mental health. No way. So that's a problem. And this sense of, and I am guilty as a parent too, oh no, my kid's good. I don't need to check what he's doing on social media. And I'm like, well, why do I think that, right? That's, he's the average teen out there. And so, but we often hold that, even, you know, I'm a therapist, I'm rooted in mental health. I believe in it. I'm okay having those conversations. But then when it's close to my kids, I'm like, oh no. But I acknowledge it. And so I do still engage with that safety piece around social media. But it's easy to hold that belief. And that belief keeps us from seeing what's right in front of us. And that's kind of what I'm hoping to stress. Okay. More kind of what we can do. Listen, I can't underestimate listening. And as a parent, especially, it's really hard to just listen without wanting to fix or do or solve or say, hey, it's no big deal. And the no big deal, I know, comes from kind of like the video, like we all have positive intentions as parents and caregivers and professionals out there, but in wanting suffering to go away, especially for the ones we love, but to just listen, not to minimize, ask questions, you know, wonder about your teens. It's, you know, asking about friends, or what are the other kids doing on campus? How are people talking about mental health? I say daily to the young people I see in my office. I just said it the other day to a male, just like, I'm so glad you guys are talking about it. They're talking about mental health. They're looking about it. They're figuring out ways. They're talking to each other. They're offering support. And we need to get on board a little bit better. Because the thing is with kids, especially if we don't give them words, if we don't help them with a narrative, a way to see the world, a way to feel, how to function in the world, they create often bigger and scarier stories about the silence parents might have or other things. We got to be able to talk to our kids because they'll create very often bigger stories about what's going on. Help your child find a mentor, supportive adult, coach, teacher. It's a huge protective factor. I don't know if you guys are aware of the ACEs study, Adverse Childhood Experiences. It was from decades of research from Kaiser, and kind of noted these adverse childhood experiences and causing later health issues in life. And a huge protective factor is having at least one supportive adult in a life could be a game changer and kind of reversing the trajectory of their future. And so really helping, talk to the school. Is there someone on campus? Most kids who I saw on campus, there was always one adult that, there was always one adult that kid could identify as, that's my safe person. And that's what I said time and time again. We got to help every kid on campus find at least like a safe person that they could go to and confide in if needed. Family meetings could be a fun and are helpful, kind of tapping in, kind of a structured way every week to kind of, okay, how's everything going? What do we need? What's going on this week? And a big one is to be honest, to say, hey, I don't know what to say, but I'm here for you. And, you know, I'll accompany you. I'll get you to where you need to go to be safe. That's a big one. And part of us as adults wanting to say, hey, it's okay, kind of silver line things, but it's not so bad. That's part of our own discomfort with those feelings and our own desire to make it go away and make them feel better is the intent. But again, that comes across as not listening, they don't get it, unvalidating. And what we know, adults too, we like to be validated. We like to know when we're doing okay. Okay, and I think, where are we going for this? We have a little bit more time. Okay, I'm gonna do this again, guys. This is, I don't know if you guys are familiar with Brene Brown. I find her lovely. This is just a short little clip on empathy. Again, kind of one of those artsy, cartoony things. But it kind of just really highlights how we could squash people sometimes, squash their emotions or feeling, not with bad intent, but just how we respond. So let me start doing this again. It's only less than a minute. Okay, I might need your help. Here we go.
If you find the link to the video and then share again, you should be able to get it.
Ah, oh no. Okay. I'm fading out, everyone. Okay, here we go.
Across the globe, vacancy taxes have failed.
No.
Make the same mistake with Med.
Did you get it? I have it. I can pull it up, but there will be a little bit of a preview on it. So let me see if I can get it.
Kind of getting all turned around now. Feelings I got, technology I don't. Oh, here we go. Okay, got it. Let's see. Okay.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Okay. Does this look okay, Natasha?
It looks great.
Okay. And we're wrapping up. I love that video. I think it just displays the difference between empathy and compassion, and it's beautiful. perfect scenario, we always do that, and it's not perfect. We're not perfect. And again, kind of going back to that ruptures and repair in relationships with our children, but also in relationships with maybe even our patients or our students, people we're working with. Hey, I kind of showed up and I was a little irritable, you know, I'm sorry. It just been, yeah, not okay. Let's try again. And so being able to go back to our young people and let's have a do-over. Moving on to kind of resources here locally, 988, and I love this so much because the kids use it. They use it. They don't always tell their parents they use it, but they use it, and that's wonderful. El Dorado County Mental Health, Sierra Child and Family Services, Tahoe Youth and Family Services. I just named like the big kind of providers in the area. Balanced Life, Barton, of course, and the wellness centers. There's currently a wellness center on the middle school campus, the high school, Talac now this year, and Bijou Elementary School. So I encourage you all, or tell your family or friends, or if you have someone that might be looking for support, those are a good spot to tap into, to talk to the counselors at their school and get your kid connected through there is often can be a easier way into the system a little bit. School counselors, again, they're a really wonderful resource and are very attuned to mental health and want support for the students. NAMI is a National Alliance of Mental Illness. There's a lot of resources out there if you're a parent or caregiver of someone who's struggling with mental health. So educate yourself about things so you can be most responsive. Assignment, homework. Oh, first let's do questions, comments. Any questions, comments?
Well, if you want to start wrapping it up, I'll look for them. And just as a reminder,
Okay.
if you have questions or comments, and we have gotten some comments, but if you have questions, you're welcome to ask them in the comment box or in the Q&A box, which is located at the bottom of your Zoom screen.
I had a train of thought that just left. Oh, as far as the advocating, so reaching out, helping your young person, adult, whoever, someone you care about, find help. Don't stop, keep trying, make that call. Call us over here at Barton if you need help to kind of find the spot. El Dorado County Mental Health, call down there. How do I navigate? Where do I start? If your kids is in school, start with the counselor. Hey, I'm kind of concerned. What do you think? Reach out. And also what I always stress to teens, even younger people, is to shop around. If you have your first initial appointment, let's say with a therapist, and you're like, oh, I don't know if it's a good fit. You know, I know for myself as a therapist, I want it to be a useful relationship. And so if it's not a good fit for whatever reason, find somebody new and don't be afraid to say that. I just the other day I had a young person and her parent come in and was kind of interviewing me, and I thought that was beautiful. So it's not uncommon for me to hear in my work like, oh, I'm not into therapy, I tried it before, it doesn't work. I get that, I hear that, and also try again, because you don't know who that next person will get, and then maybe it's a different time and space. But also with that, a little before I wrap up with the homework, is this notion of forcing our kids into do something, a teenager forcing them to go into therapy. Sometimes it's necessary, but a little caution around that, because if they were really in a predicament in the future, they might be less likely to access it because of this push to do it. But again, kind of making those calls, expanding kind of the support system to problem solve how you get your young person or someone you care about to get help. Ask around, talk to other people, share stories, let people in. So the homework was just that. Talk to your family, talk to your kids, open up a conversation, wonder about them, talk to a coworker, do something in the coming weeks that addresses this need to check in with the people closest to us. How you really doing? What are you feeling? How's life going? Check in with someone strategically about their feelings, about how they're functioning, what are stressors, how do they manage it, how's their sadness. Check in with someone. That's it.
Awesome. I haven't seen any questions come in, but while I'm still monitoring that, I wondered if you could explain 988 for folks that may not be familiar with it.
988, you could text 988. It's a number where people could get access to support if they're having suicidal thoughts, if they're having a conflict, if they're not feeling safe, if they're not feeling well. It's a text. You text the number, and someone responds and helps you walk through things, and depending on the level, can connect to local resources where that person is calling or texting from.
And you can call as well, correct? You want?
You can call as well.
Great. I haven't seen any questions come in, which usually means that you covered the bases really well. I'll just start to wrap up, but keep an eye. Just a reminder that this webinar has been recorded and it will be available on YouTube. Carolyn mentioned a wellness webinar that was done earlier this year with Dr. Patel on social media and phones and kids. So if that's of interest, that's a great follow-up. There's a lot of past webinars that are available there. And we will have a short survey at the conclusion of this Zoom. So we'd love to get your feedback, hear how we did, and what future topics you'd like to hear. But I think, Carolyn, we're going to go ahead and wrap it up.
Excellent.
And really appreciate you being here. There was really nice comments about appreciation for the talk tonight and the videos. So those are all available on YouTube as well, right? So if they want to reference them again, they can do that. But appreciate everyone being here and hope you enjoy the rest of your night. Thank you.
Thank you, guys.